So allogeneic transplant is a really important part of the care of AML. It's typically something we do after patients have received a complete remission to try and keep them in remission and prevent relapse. You can generally put it into two groups of conditioning regimens. There's the myeloablative, or the traditional form of conditioning prior to transplant. And then more recently there's been reduced intensity approaches which try and make the treatment itself more tolerable. Yeah, so myeloablative conditioning is associated with quite high levels of toxicity, and so it's something that's not always suitable for older patients, as AML patients often are. And so it's been often investigators' discretion of whether a patient could tolerate myeloablation versus reduced intensity, which is really the question of who should get what is really what motivated this phase 3 clinical trial. So prior to the study, it was known that measurable residual disease was an important prognostic factor going into an allogeneic transplant for patients with AML in remission. And so by that I mean, if you have MRD detectable despite being in conventional remission, we knew that your chance of relapse was high after a transplant. Well, this study added additional information about, can we do anything about that prognostic factor? So this was a laboratory study performed at the NIH looking in blood samples from patients prior to enrolling on the phase 3 study and looking for any evidence that there was residual leukemia left. So by traditional clinical assessment, by morphology, they were in remission. We're using very advanced deep sequencing to try and see is there any trace of a mutation which is often associated with leukemia left in those patients. Sure. So the BMT CTN 0901 study was a randomized phase 3 study performed by the Blood and Marrow Transplant Clinical Trials Network between 2011 and 2014. It was a really important study, and randomized studies in transplant are really important in AML to get us clear answers. It was a study that was actually stopped early, and it was stopped early because there seemed to be an increased risk for those patients getting reduced intensity transplant. What motivated the work we're presenting here at EHA in the Presidential Symposium later today was the idea that we could maybe look at those people who got reduced intensity and try and find a group that was at highest risk of relapse after getting reduced intensity transplant. And so our study is a laboratory add-on to that 0901 study trying to explain those striking clinical findings in that randomized trial.